They are a healthcare network composed of one flagship complex, 4 provincial hospitals, and over 50 clinics in Metro Manila and in select provinces in the Philippines. So in 2024, the Medical City Clinic, or TMC Clinic, reinforced its reputation as a leader in primary healthcare, earning the Primary Care Provider of the Year award again. So before I welcome our speaker, we have a quick video that we'd like to share everybody to show and discuss TMC and the TMC Clinic. So please watch this. So to speak with us this morning about sustainability in healthcare, building a culture of care for people and planet, we have here with us this morning TMC's leader in sustainability direction, governance structure, and ESG performance initiatives across its hospitals and clinics. He has over 14 years of experience in sustainability and ESG management, having held leadership roles at Ernst & Young Global Delivery Services, KPMG Philippines, and Anthesis Consulting Philippines. So please welcome on stage TMC's Group Head of ESG, Mr. Allan Gabriel Carasco.
All right. Good morning, everyone. Morning, good morning. Okay pa ba? Yes. All right, good. So just to reintroduce myself, I'm Allan Gabriel Carasco. I am the group head for ESG. So ESG, it means environment, social governance for the whole TMC enterprise, the Medical City enterprise. Briefly, a little bit about TMC. So the Medical City is the largest healthcare network under the same brand, under a single brand in the Philippines. We have 5 hospitals, including our main hospital in Ortigas, and 4 regional hospitals, and about 72 clinics, right, across the Philippines. And siguro, to be honest din, no, kami din, we are very inspired, katulad ninyo, we are also inspired by the likes of Ayala Land, SM, kasi they are very much mature na rin in their sustainability journey. Admittedly, kami in the healthcare sector, medyo nasa start pa kami. We are in the nascent stages of our sustainability journey. But that doesn't mean to say that we are lagging. We're getting there. We're also working towards a more sustainable future. And I think in the healthcare sector, I think we are in a unique position. Kasi I heard this particular definition of what a hospital is. Ang sabi, what is a hospital? A hospital is a place where people find themselves at the most vulnerable or intimate moments of their lives. Tama ba yun? Do you agree with that? What is a sustainable hospital? Para sa amin, a sustainable hospital is a hospital with a heart, where the primary stakeholder is the human soul. So that's how we define a sustainable hospital. Okay? Now, building on that, let's start with our presentation. All right. So, let me start with something simple. Healthcare is about caring for people. Real care does not end when someone leaves the hospital. It follows them into their homes, schools, workplaces, and communities. So when we talk about sustainability in healthcare, we are talking about building a world where people, including all of you, can live healthier, safer, and better lives. Now, why should this matter to you? Bakit kailangan nating malaman to? Bakit to importante para sa atin? The environment where you grew up in, or where you grow up, influences your health more than you think. And more than any medicine you know. The air you breathe, the water you drink, the climate you live in, shape your well-being every day. Sustainability will also shape your future careers. Whether you enter healthcare, business, engineering, design, technology, or public service, it will become part of the work that you do. Now, you are the generation that will inherit the systems that we are building. Katulad yan ang sinabi nila ma'am from Ayala Land and Caesar from SM. Your voice, your choices, and your mindset make a real difference. Now, let us clarify what sustainability in healthcare really means. It is not about complicated policies or technical language. It simply means three things. We protect people's health. We take care of the planet that supports that health. And we prepare the next generation, kayo yun, to continue improving the system. People, planet, future. If we get these right, we are on the right track. So, caring for people by keeping the hospital safe, giving fair access to care or universal health care, and supporting healthcare workers. Caring for the environment, because clean air, safe water, and a stable climate directly affects health. In caring for you, the next generation, we're making sure healthcare system continues to function even during different challenges. Like for example, yung nakaraang pandemic, we need to make sure that our healthcare systems are sustainable so that if magkaroon ng susunod na pandemic, sana naman hindi, but if it does, the system still works. Now, a sustainable healthcare system starts with caring for people. This means safe hospitals, supported healthcare workers, and communities with access to care when needed. It also means caring for your own well-being. You, the next generation of professionals, will eventually be the ones taking care of others. If we do not take care of the people now, the entire system suffers later. Now, When I was visiting one of the hospitals, isa sa mga hospitals namin, I interviewed one of the nurses. Sabi niya, sir, sometimes yung init, mas mahirap pa kaysa dun sa shift nila. Kasi minsan may mga times na mahirap i-control yung climate or mainit talaga in certain seasons. No? So, this reminded me that the environmental conditions at work affect the well-being of the people caring for us. Right? So when we improve the environment, patient care improves immediately. Also, burnout. Studies have shown that burnout in healthcare workers increases medical errors, turnover in costs, and it weakens the resilience of hospitals. Now, if we don't care for the healthcare workers, the whole system eventually breaks. So a sustainable system starts with protecting the people who protect us. Now, let's talk about the planet. Now, there is no healthy community without a healthy environment. It does not matter how advanced a hospital is. If the air is polluted, the water is unsafe, or climate-related emergencies keep disrupting lives, people will continue to get sick. Greener, cleaner, and smarter environments directly affect your health, your future families, and the kind of world that you will live in. Now, for example, after the recent typhoons, yung Typhoon Tino, Typhoon Uwan, syempre apart from the property damages, of course, there are also health risks related to that. According to DOH, health risks spiked as flooding and infrastructure damage disrupted care access. It also reported spikes in leptospirosis and waterborne diseases in flood-affected regions. So, because of climate change, naapektuhan yung health natin. Now, this is why we talk about a culture of care. A culture of care means we care for the environment, we care for people, and we care for the communities that shape our daily lives. When these three pillars are strong, we do not only treat illness, we prevent it. We build resilience. We give people a fair chance at a healthy life. At the Medical City, we bring these pillars to life through real initiatives, through community engagement, supporting the well-being of our healthcare workers, and forming partnerships that advance sustainability. For community engagement, some of our initiatives include Hair for Hope, wherein nag-invite kami ng mga donors, ng mga volunteers na mag-donate ng hair nila for our cancer patients. We also have different medical missions. So within our hospitals, the different departments, yung cardio, neuro, oncology, and so on and so forth, mga different departments, meron silang kanya-kanyang mga medical missions that they conduct with different partner communities. And then meron din, we also have Brigada Eskwela, where we teach hand hygiene and prevention of seasonal diseases, and so on and so forth. We, what's unique about the medical sector, what's unique about the healthcare sector is that we are in a position wherein we directly affect our different communities where we are located. So, sa mga hospitals namin in different regions, sa Iloilo, sa Pangasinan, sa Clark, we have our own medical missions and community outreach programs. And then employee engagement, we have our wellness drives for mental health awareness and skills training programs for all of our employees. And then for sustainable partnerships, we partner with different industry players, NGOs, local governments, international organizations on different sustainable initiative programs like food waste project, our waste electronic devices project, and so on and so forth. Now, let's focus on you. Sustainability is not just a corporate or government responsibility. It begins with people, especially young people, choosing better habits, asking better questions, and supporting better systems. This can start with simple actions like managing waste, conserving energy, joining community work, carrying sustainable thinking innovation, and also into your careers. Your generation already challenges the norms. Speak up and drive innovation. That energy is exactly what sustainability needs. So let me close with this. Building a healthier future is not about one major breakthrough. It is about consistent decisions, small ones today and bigger ones as you move forward in your careers. Choose to care for people, choose to care for your community, choose to care for the planet that gives us life. Your actions today and your leadership tomorrow will help create a future that is healthier, safer, and more sustainable. And that future begins with you. Thank you very much, everyone.
Thank you very much, Sir Allan.